Hello everybody and welcome to the Thursday edition of Video Clips, and today I have all good news for you, which rarely happens in these clips. And we'll just start with this. Last month, Alex Azar announced that drug companies would be required to disclose the prices of their products if they exceed $35 per month, or the price of a course of treatment if it's not prescribed for a chronic condition in an ongoing way. Drug companies are required to update the prices every quarter, and the disclosure has to be legible and clear at the end of the ad, just like side effects are required to be. Well, this is considered a positive action by almost everybody. Nobody disagrees with it, which is unusual. The Trump administration promised that it would address the high cost of drugs in 2017 when Trump took office, and disclosure is one way of doing so. Advocacy groups have pushed for disclosure for a really long time, and one of the reasons is newer drugs that are aggressively promoted on television are not necessarily better, and they're often indeed worse and have worse side effects than older drugs. But the ads motivate patients to ask for them anyway. In fact, some of the ads actually encourage this by telling patients at the end, ask your doctor about this or that drug for whatever condition it's advertised for. Talk to your doctor. Although the move was endorsed by both parties, Congress has tried on a number of different occasions to pass legislation and failed to do so, so this particular action sort of sidesteps all that, and it's the new rule. It's most likely that the rule will have some effect on consumer behavior. For example, Humira, which is prescribed to treat rheumatoid arthritis and other autoimmune diseases, costs $5,684 a month. And Xeljanz, which is also prescribed for arthritis, costs $4,840 per month. Now, I think most people have no idea how much these drugs cost, although people are always saying, why is healthcare so darned expensive? This is part of it. And I think knowing how expensive the drugs are may cause some people to look for other options, or at least to be angry. I mean, it'd be nice if people were angry about the right things for a change, and the prices of drugs are, I think, something everybody could be angrier about. Well, it won't surprise you to know that the drug companies are very unhappy about this rule, and they immediately started complaining. Three of them, Merck, Eli Lilly, and Pfizer, along with an advertising trade group, decided to file a lawsuit against the Trump administration. They are arguing that the rule is illegal because it violates their First Amendment rights. Well, I think they don't understand the First Amendment, because the First Amendment does not give you the right to withhold buyer information that's necessary for making an informed decision. That's not part of the First Amendment. Mr. Azar actually used to be an executive with Eli Lilly before joining the Trump administration, and here's what he has to say about unhappy drug companies. He said, if you're ashamed of your drug prices, change your prices. It's that simple. He points to other industries which are required to do the same thing. For example, for 50 years, car makers and car dealers have been required to post the sticker prices of cars on the window. Azar also stated that drug companies may be motivated to lower their prices due to concerns that sticker shock may alone cause some people to ask for or seek other alternatives. In fact, that is what the drug companies are the most afraid of. Merck issued a statement saying that, quote, we believe new requirements may cause patients not to seek treatment because of their perception that they can't afford their medications. Well, that's a pretty hollow argument, because the rules include a disclaimer that also appears in the ads stating that, quote, if you have insurance that covers drugs, your cost may be different. The bottom line is that the drug companies do not want people to know how much the drugs cost, regardless of who's paying the bill. This situation is just one example of how dysfunctional the medical system is. No other manufacturer or retailer of any other product or service claims that prices and products for services should be kept a secret. I mean, in fact, the marketplace works best when prices and everything else about products is transparent. Many companies and retailers actually advertise their prices. This promotes competition in the marketplace, which results in better products and services at lower prices, and that's good for everybody. Better for consumers and better for everybody. And so I think it's time for medicine to function a lot more like other businesses. And there are people who argue against this, saying that patients aren't consumers and doctors aren't service providers. Well, that's exactly the way things are, and there's no reason why it shouldn't be that way. So overall, I look at this as a step in the right direction, and I don't have any thought at all that the drug companies are going to prevail on this stupid lawsuit that they filed. Because again, the First Amendment does not give you the right to withhold information that facilitates informed buying. Okay, so on to good news number 2. According to a new meta-analysis, taking yoga classes is a good way to reduce your blood pressure. I've known that for a long time because I'm a consistent yoga practitioner. But anyway, the review included 49 trials with over 3,500 subjects. The characteristics of the subjects were they were overweight, middle-aged adults with average systolic pressure of 129, average diastolic pressure of 80.7. So they were just slightly hypertensive. The study showed that 3 yoga classes per week resulted in reductions of 11 points in systolic pressure and 6 points in diastolic pressure. The study is important for a couple of reasons, and one of the big ones is that people with slightly elevated blood pressure don't benefit from taking medications. A Cochrane review of 4 randomized controlled trials with over 8,900 subjects with mildly elevated blood pressure showed that after 4 to 5 years of follow-up, there was no benefit from taking medication. Now, while nobody benefited, about 9% of the participants dropped out of the studies because of the side effects of the drugs. So, in other words, yoga is not only helpful for lowering blood pressure, it's safer and more effective than medication for those who have mildly elevated blood pressure. Now, I did some research to look into how many other studies I might find that showed similar results, and I found something interesting. Practices associated with yoga, such as meditation and chanting, also have a similar therapeutic effect. For example, Om is a mantra that's often used in Indian meditation and yoga practice specifically to quiet the mind, and it's been proven to reduce blood pressure too. One study included 50 people who had mild to moderate hypertension in spite of taking medication. Blood pressure was measured before and after chanting Om for 5 minutes. Systolic pressure dropped by 14 points, and diastolic pressure dropped by 5 points. Average pulse rate also dropped by 6 points, and this is 5 minutes, one time, chanting Om. So think what would happen if you took yoga classes and you engaged in these practices on a regular basis. I'm sure that we'd see blood pressure being lowered in people who have even higher blood pressure than just 120 and 129 over 80 or mildly elevated blood pressure. Another study involved 40 women who were randomized to daily Om chanting under the supervision of a yoga instructor for 6 months or a control group. Systolic pressure, diastolic pressure, pulse rate, depression, anxiety, and stress decreased significantly in the intervention group as compared to the controls. And again, I could tell you that from just personal experience being a yoga student myself and teaching yoga and seeing what happens to people who regularly come to yoga. I think it makes us all nicer people, to tell you the truth. I know I'm nicer as a result of it, and once in a while if I'm meditating or talking to myself about, should I go to yoga, should I not go to yoga, people around me go, you should go to yoga. We'll be fine, go on ahead. And the reason is they know I'm easier to get along with when I go. So anyway, studies have actually identified a mechanism of action that explains the beneficial effect, and I think this is really interesting. MRI scans taken while one group chanted Om and a control group chanted S, which I don't know how you chant that, but anyway, they used a different sound, show that brain activity while chanting Om is similar to the effect of vagus nerve stimulation, which is sometimes used in the treatment of depression. I would argue that yoga is better than vagus nerve stimulation, but in any case, I would argue that yoga is better than a lot of things for health-related issues. Yoga classes and chanting and meditation are inexpensive and easily accessible. In fact, options range from online video tutorials and classes to sessions held in community centers, churches, and health clubs. Yoga has a lot of benefits besides just what I'm telling you here. It calms the mind, it improves focus and concentration. From a physical standpoint, it improves balance, coordination, and strength. It helps to improve alignment and can be useful in relieving joint and muscle pain, as well as overuse injuries from sports activities. While these strategies have been effective, they've been proven to be effective on their own, they're even more powerful when you combine them with other things. So think what would happen if you engaged in some daily meditation and you went to yoga and you drank enough water every day and you slept well and you ate an optimal diet and you did some strength training and you did all the other things I talk about all the time. I mean, the combination and the cumulative effect of these things is even better. So I promised you good news. Good news in that the drug companies are having to comply with things they don't like. I'm always happy to hear that. And good news in that something simple and inexpensive that's really good for you is good for you in ways that you might not even have imagined. Okay, that's all for today and all for the week. As usual, hit the subscribe button if you're not a subscriber and pass this on to anybody who you think would enjoy watching it. And I'll be back to you next week with more news.